Here, let's not forget the uterine cycle or the menstrual cycle. These are the cyclical changes in the uterus that accompany the hormonal changes in the ovarian cycle. The cyclical changes in the uterus they result in the menstrual bleeding once during each menstrual cycle means once a month, and the bleeding lasts for about 5 to 7 days after the degeneration of corpus luteum. Menstrual cycle it coincides in timing with the early phase of ovarian follicular phase, and the menstrual cycle itself that consists of three phases. The first, that is the menstrual phase, which consists of the menstruation, of course. Then there is the proliferative phase, and finally there comes the secretory or progestational phase. The menstrual phase that is characterized by the discharge of blood and the endometrial debris from vagina, and it is considered to be the start of a new ovarian cycle as it coincides with the end of the luteal phase and the onset of follicular phase. A cause of this phase is the involution of the corpus luteum in ovary. Well, next is the proliferative phase, which is also called the estrogen phase, and it is characterized by the repair and the proliferation of the endometrium. The endometrial surface that is re-epithelialized within 4 to 7 days after beginning of the menstruation. So, do you wonder why it is named estrogen phase? You see, the estrogen it plays a key role by stimulating the endometrium to proliferate, and estrogen is secreted in increasing quantities by the ovary during first part of ovarian cycle. Now, let's have a look at the effects of estrogen in the proliferative phase. Its stimulation it causes the proliferation of the epithelial cells and the blood vessels. Stromal cells they also proliferate rapidly. So during next week and a half before the ovulation, the endometrium it increases greatly in thickness, resulting in a net thickness of 3 to 5 millimeters of the endometrium due to the increase in stromal cells, due to the growth of endometrial glands, and new endometrial blood vessels. Well, the proliferative phase it occurs before ovulation and it coincides with the last part of the follicular phase. As far as the importance of the endometrial proliferation is concerned, you should know that at the beginning of each monthly cycle, most of the endometrium it has been desquamated by the menstruation, and only a thin layer of the endometrial stroma that remains, where only the epithelial cells that are left, they are those which are located in the remaining deeper portions of the glands or the crypts. Now, there is an additional advantage also. You see, the endometrial glands, especially those of the cervical region, they secrete thin, stringy mucus. And these mucus strings, they align themselves along the length of the cervical canal, forming the channels that help guide the sperm in proper direction from vagina to uterus. Well, next is a secretory phase. A secretory phase makes the later half of monthly cycle, and this coincides with the luteal phase of the ovarian cycle. After ovulation, when the corpus luteum that is formed, the uterus enters secretory or progestational phase. Corpus luteum secretes progesterone mainly and also estrogen. The progesterone converts the thickened estrogen primed endometrium into glycogen filled tissue. The peak of the phase that occurs about 1 week after ovulation. During this part of the cycle, the endometrium it has a thickness of 5 to 6 millimeter due to progesterone and estrogen induced effects, where the estrogen it causes slight additional cellular proliferation. The effects brought about by progesterone they include mm, marked swelling of endometrium and the endometrial secretory development. Glands they also increase in tortuosity, and there is accumulation of an excess of secretory substances in the glandular epithelial cells. Plus, the cytoplasmic increase in the stromal cells, where not only the glycogen but lipids they also deposit. Then there is increase in the blood supply, which is proportional to the secretory activity, and these blood vessels they become highly tortuous. Well, this phase is called the secretory phase because the endometrial glands they are secreting glycogen, or the or this phase is called progestational uh, before pregnancy, which refers to the development of an endometrial lining which is capable of supporting an early embryo. Purpose of endometrial changes, uh, that is to produce a highly secretory endometrium that contains large amounts of stored nutrients to provide appropriate conditions for the implantation of fertilized ovum in the blastocyst stage. Availability of great quantities of the nutrients to early implanting embryo. That is the purpose of the endometrial changes. Uterine milk is a name which is given to the uterine secretions and it provides nutrition for the early dividing ovum until it implants. After implantation, means 7 to 9 days after the ovulation, the trophoblastic cells they absorb the endometrial stored substances. If fertilization and implantation they do not occur, the corpus luteum degenerates and a new follicular phase and the menstrual cycle starts. Menstruation occurs if the ovum is not fertilized, and the cause is the low levels of ovarian hormones, means the estrogen and progesterone. Changes occurring in menstrual phase they include a reduction in the estrogen and progesterone. So there is a decreased stimulation of the endometrial cells by ovarian hormones, and that resulting in involution of the endometrium to about 65% of its previous thickness. Also, there is vasospasm in the mucosal layer of the endometrium by the vasoconstrictor prostaglandins, whose release in turn that is involution induced. And all this that results in the necrosis of endometrium and its blood vessels. So, when you are to enlist the causes of the endometrial necrosis, the list will consist of the vasospasm, decrease in the nutrient supply, and loss of hormonal stimulation. So, due to this necrosis, blood seeps into the vascular endometrial layer, and hemorrhagic areas they grow rapidly over a period of 24 to 36 hours, and the necrotic outer layers of the endometrium they separate from the uterus. The separation it occurs at the sites of the hemorrhages, and as a result the superficial layers of the endometrium they are desquamated about 48 hours after the onset of menstruation. The next question is that how uterine contractions they start during menstruation. These contractions they are responsible for the expulsion of uterine contents, which are the mass of desquamated tissue, blood in the uterine cavity. These contents and certain contractile substances they cause the contraction. Uh, Let me now walk you through the process again. So what happens that there is degeneration of the corpus luteum, and of course with this degeneration there are decreased levels of the estrogen and progesterone, and the decreased levels of the ovarian hormones they stimulate the release of prostaglandin, and these prostaglandins they cause vasoconstriction of the endometrial vessels, and they disrupt the blood supply to the endometrium. Then because of there is you see there is reduced oxygen supply to the endometrium, and that causes its death including the blood vessels, and that results in bleeding along with the endometrial debris from the uterine cavity, and this is known as menstrual flow. Approximately 40 milliliters of blood and an additional 35 milliliters of serous fluid they are lost normally, and don't forget that menstrual fluid is non-clotting. After menstruation within 4 to 7 days the loss of blood ceases, because by this time the endometrium it has become re-epithelialized. Let's now have a look at the functions of female reproductive hormones, means the functions of estrogen and progesterone. Mm, Primary function of estrogens is to cause cellular proliferation and growth of tissues of sex organs and other tissues related to reproduction. If you want to get into the detailed functions of estrogen, remember that it acts on uterus, external female sexual organs, and fallopian tubes, and also the breasts. So, in the tubes, it causes proliferation of the glandular tissue of mucosal lining. Plus, it increases the number and the activity of the ciliated epithelial cells lining the tubes. Then it initiates growth of breasts and of milk producing apparatus in it by the development of stromal tissue of breasts, by the growth of an extensive ductile system, and by the deposition of fat in breasts. Keep in mind what I just told you, I want you to choose an option for this simple MCQ. And here is another one, but don't forget to read the stem carefully first. So, you chose your options. Now, let's confirm it. We will see that how estrogen causes a feminine figure as its effect on the protein deposition is comparatively a slight increase in the total body protein, while the male body contains more protein due to testosterone. More importantly, estrogen causes increased fat deposition in the breasts, subcutaneous tissues, and buttocks and in thighs. So, the percentage of the body fat in the female is comparatively greater. Right. Now don't be amazed when I tell you that the functions of estrogens they encompass the skeleton also because estrogens stimulate bone growth. Actually a rapid growth in height at puberty. And comparatively it has a stronger effect on the union of epiphysis with the shafts of the long bones. Osteoporosis in old age that is caused by estrogen deficiency after menopause, which leads to increased osteoclastic activity, decreased bone matrix, and decreased deposition of bone calcium and phosphate. Other effects of estrogen they are on skin, metabolism, and also on the electrolyte balance. For the body metabolism, it causes a slight increase in the BMR comparatively. Then it makes our skin soft, smooth, thicker, and more vascular. For electrolyte balance, it may cause a slight retention of sodium and water, which becomes significant in pregnancy, while on hair distribution, it has no great effect. The other female reproductive hormone is progesterone. Now, focus on what functions progesterone has. In a non pregnant woman, along with estrogen, it inhibits the secretion of FSH and LH from the anterior pituitary in the second half of cycle. Next, it stimulates and supports the thickening and increased glandular development of uterine lining during secretory phase of monthly cycle. It causes increased secretion by mucosal lining of fallopian tubes. Now, the effect on the breasts. In the female, the breasts they are small and immature until puberty. Thereafter, they grow and develop under the influence of progesterone, but not without estrogen. The main role that comes during pregnancy when these hormones they stimulate further growth. You see, basically, this hormone that is the progesterone that is essential for the maintenance of pregnancy. What you should focus is the effect of progesterone on uterus. Progesterone promotes secretory changes in the uterine endometrium during later half of monthly cycle. It prepares the uterus for implantation of the fertilized ovum. And in addition, it decreases the frequency and the intensity of uterine contractions, thereby helping to prevent the expulsion of implanted ovum. Progesterone increases the secretion by the mucosa of fallopian tubes, and these secretions they are necessary for the nutrition of fertilized dividing ovum as it traverses the fallopian tube before implantation. Then, progesterone promotes the development of breast lobules and alveoli, causing the alveolar cells to proliferate, enlarge, and become secretory. This development is primarily dependent on progesterone because the estrogens they cause only slight influence on lobules and alveoli. Let's see how progesterone causes part of this swelling. It is due to the secretory development in the lobules and the alveoli, but partially it also results from the increased fluid in the tissues. Now what it doesn't do, you see, progesterone it does not cause the alveoli to secrete milk. Milk is secreted only after the prepared breast is further stimulated by prolactin from the anterior pituitary. Again, students, I got a question for you, and I hope you can easily choose a correct option and write it in comments.